You've done a beautiful job highlighting the clinical need of understanding individuals with obesity in the context of osteoarthritis. And one of the big gaps there is that a lot of the epidemiological data doesn't really consider exactly what you're saying, which is, what is that tissue? What is it comprised of? And we know that the amount of muscle and the amount of fat or adipose tissue does matter. And I think fat is so fascinating because historically and evolutionarily, it really was something that we needed and we lacked, and we were in situations of undernutrition. And so now it's almost like it's trying too hard to help us, and it's having all these off-target effects that we're now looking at in different basic science models. But I think that understanding alone will hopefully lead to past osteoarthritis and into other fields on this importance of documenting body composition and what these tissues are as far as understanding multimorbidity.
Yeah. It's a very complex tissue, but you know at the beginning of this story was the fact that epidemiological studies, and some were very strong, showing that the patients with obesity increase their risk of having hand osteoarthritis.
Yes.
This was the how all this story started.
Yes.
And a twofold increase in hand OA in patients with obesity. And of course, this means that there is something coming from the adipose tissue that will impact the joints. And what we have learned in the last years is that probably the impact of what is delivered by the adipose tissue in order to have this increase in OA is more on the symptoms than on the structure. There is something also for the structure, an impact on the structure, but it seems that what we have seen was mainly on symptomatic OA. Mm-hmm. And the fact that when there is obesity, the context of obesity and probably what is released by the adipose tissue will increase the symptoms, will increase the pain of OA patients. And I must say that this will be the challenge for the next years.
Yes.
The challenge for the next 5 to 10 years will be to understand pain in OA. It seems very strange that the main symptoms for the patient is pain.
Yes.
And probably is what we know, we really do not know today, is the mechanism of pain in OA. And so we are learning a lot on that field now. There are very strong groups now working in the field of pain, and maybe 20 years ago, the interactions between the groups working on pain and the groups working on OA were not really communicating. Mm-hmm. And now I think there is strong interactions between the groups working on experimental pain and the groups working on experimental OA.